our current issues topic is nursing ethics. Ethics basically describes what is right and what is wrong. And so this helps guide nurses in what they do and how they go about their job with patients and interactions to help make sure everything is good.
In nursing, there are 6 common ethic principles. The first one is non-maleficence. That means you remain competent in the field and report suspected abuse of either the patients or of their information. Number 2 is beneficence. That means having compassion, taking positive actions to help others, and following through on the desire to do good. Number 3 is fidelity. Fidelity is keeping commitments based on virtue and of caring. And number 4 is autonomy. Autonomy is respecting patients' wishes even if you don't agree with them. And that's probably the hardest one of the 6 nursing ethic principles to keep. And number 5 is principles of integrity and totality. That means considering the entire person when deciding which therapies they use and which medications and how to just help them in general. And number 6 is justice. That means treating patients fairly and equally.
So the 3 most common challenges regarding ethics in nursing are obtaining consent, which just means you're verifying permission to give care, telling truth to your patients. Some families don't want the patients knowing the specific conditions of the patient, but they have a right to know. Patient confidentiality is also a big problem. Keeping their information private inside and outside the workplace is just needed and mandatory.
HIPAA, or the Health Insurance Portability and Accountability Act, was an act that was put in place to improve healthcare and to keep medical professionals and others ethical. The 2 main goals of HIPAA were to protect insurance coverage for individuals and families when they lost their jobs, and also to protect patient confidentiality and health data integrity and availability.
In the years leading up to HIPAA, there were many ethical problems that were presenting themselves in the medical field. One was that if people didn't have work, if they were in between jobs, they stopped receiving medical insurance, and they were really sad. Also, technology was starting to become more prominent and more evident in society, which led to an increase of people being able to hack into medical records and send medical records to mean people, or people that shouldn't be involved in knowing them. And so in 1966, Bill Clinton signed the HIPAA Act.
So some of the current implications of HIPAA regard online information. Online information must be protected by the medical facility, and they should have protection in place from online hackers. The computers throughout the medical facility should also have safeguards in place to prevent information leaks, such as automatic logoffs whenever personnel leaves the computer. The medical facility should also have physical barriers throughout to ensure only authorized personnel can see the patients and their information. HIPAA also prevents medical personnel from sharing any information regarding a patient with anyone without permission from the patient.
My name's Ella.
Hi, I'm Brinley.
I'm Emily.
I'm Caroline.
I'm Luke.
And I'm Brinley.